Hey everyone, welcome back to the channel. Today we're tackling a really important and often misunderstood topic in addiction medicine: Suboxone induction for opioid use disorder. This is a critical first step on the path to recovery for so many people, but it's a process that has to be done correctly and safely. We're going to break down what it is, why it's done a certain way, and what you can expect. This isn't just about taking a medication, it's about starting a new chapter, and like any major medical procedure, it requires knowledge, care, and professional supervision. Now, I want to be crystal clear from the start. This video is for educational purposes only. It is absolutely not a substitute for professional medical advice. The process I'm about to describe must be done under the direct supervision of a qualified healthcare provider, like a doctor or a nurse practitioner who is licensed to prescribe this medication. Attempting this on your own can be dangerous and counterproductive to your recovery. The goal here is to empower you with information so you can have a more informed conversation with your healthcare team and understand the why behind their instructions. So we're going to walk through the step-by-step process of a typical Suboxone induction. We'll cover everything from the right time to start, to the initial dose, and how doctors adjust the medication to get you stable and feeling better. It might sound complicated, but my goal is to make it as clear and understandable as possible. Understanding the process can help reduce anxiety and set you up for success. So grab some water, get comfortable, and let's get into it. The absolute most critical factor for a successful Suboxone induction is timing. This isn't something you can rush. We have to wait until the person is in a state of moderate opioid withdrawal before starting the first dose. I know this sounds counterintuitive, even cruel. Why would we wait for someone to feel sick before giving them medicine to feel better? The reason is something called precipitated withdrawal, and it's a state we want to avoid at all costs. It's an intense, rapid onset, and severe form of withdrawal that can be traumatic and dangerous. So, how do we know when the time is right? Healthcare providers use a specific tool called the Clinical Opiate Withdrawal Scale, or COWS. This is a standardized checklist that helps us objectively measure the severity of withdrawal. We look for a collection of signs and symptoms. Things like a racing heart, sweating, restlessness, dilated pupils, aching bones and muscles, anxiety, a runny nose, and gastrointestinal upset like nausea or diarrhea. Each symptom is given a score, and once the total score reaches a certain threshold, usually indicating moderate withdrawal, we know it's safe to begin. Starting too early, when there are still other opioids like heroin, fentanyl, or oxycodone fully attached to the opioid receptors in your brain, is the problem. Suboxone contains buprenorphine, which has a very strong attraction to those receptors. If you take it too soon, the buprenorphine will aggressively kick the other opioids off those receptors, but it doesn't provide the same level of activation. This sudden drop in receptor stimulation is what throws the body into that immediate, intense, precipitated withdrawal. It's a physiological shock to the system. Waiting is non-negotiable for a safe and effective start. Once we've confirmed that the patient is in moderate withdrawal, it's time for the first dose of Suboxone. The guiding principle here is start low and go slow. We're not trying to completely eliminate all withdrawal symptoms with the very first dose. Instead, the goal is to introduce the medication safely and see how the body responds. A typical starting dose is a small piece of a Suboxone film or tablet, usually containing 2 milligrams or, in some cases, up to 4 milligrams of the active ingredient, buprenorphine. This initial dose is usually given right there in the clinic or doctor's office. This is so important because we need to be able to monitor the patient directly for at least the first hour or two. The patient places the film or tablet under their tongue. This is called sublingual administration and allows it to dissolve completely. It's crucial not to swallow it, as the medication is not well absorbed through the stomach. The area under the tongue has a rich supply of blood vessels that allow the buprenorphine to be absorbed directly into the bloodstream, where it can travel to the brain. After that first dose is administered, the waiting and observation period begins. We're looking for two things. First, and most importantly, we're making sure the patient doesn't go into precipitated withdrawal. If we timed it right, this is very unlikely, but safety is always the top priority. Second, we're looking for a small initial sign of relief. The patient might notice their anxiety lessen slightly, or their muscle aches might become a little less intense. The goal isn't complete comfort yet, just a sign that the medication is starting to work as intended. That period after the first dose is all about careful observation and communication. As a doctor, I'm watching the patient's physical signs, but I'm also talking to them constantly. How are you feeling? Has your restlessness changed? What about the stomach cramps? We might even re-administer the COWS scale to get an objective measure of how their withdrawal score is changing. The goal is to see that score start to trend downwards, even if it's just by a few points. This tells us we're on the right track. This monitoring phase is a delicate balance. We need to give the medication enough time to take effect, which is typically about 60 to 90 minutes. During this time, we're looking for any signs of improvement. The patient might report feeling a bit calmer or that the crawling sensation in their skin is subsiding. These are positive indicators. On the flip side, we are also vigilant for any adverse effects. While rare, side effects like headache, dizziness, or nausea can occur. It's also the final checkpoint to ensure precipitated withdrawal isn't happening. If the patient suddenly feels much worse, we know we have a problem that needs immediate management. This constant feedback loop between the patient and the provider is what makes a supervised induction so much safer and more effective than trying it alone. A patient might feel discouraged if they don't feel 100% better after the first dose, but the medical team knows this is normal. We can provide reassurance and explain that this is just step one of a multi-step process. It's about managing expectations and building trust. This initial phase sets the tone for the entire treatment relationship, showing the patient that we are there to guide them through this process safely. So, the first dose has been given and the patient is showing some mild improvement, but they're likely still experiencing significant withdrawal symptoms. This is where the titration phase begins. Titration is just a medical term for carefully adjusting the dose of a medication until we find the optimal amount that works for the individual. With Suboxone induction, this means giving additional small doses, spaced out over several hours, until the patient's withdrawal symptoms are adequately controlled. It's a process of building up the level of medication in the body slowly and safely. Typically, if the initial 2 or 4 milligram dose was tolerated well, we might give another 2 to 4 milligrams about 90 minutes to 2 hours later. We then wait and observe again. How did that second dose feel? Are the symptoms continuing to improve? We repeat this process, giving small incremental doses and reassessing the COWS score each time. The goal is to find the lowest effective dose that holds the patient, meaning it relieves the majority of their withdrawal symptoms and cravings without causing oversedation or other side effects. The total dose on the first day can vary widely from person to person, but it often ends up somewhere between 8 and 16 milligrams. For some individuals, especially those coming off very high doses of potent opioids like fentanyl, it might be even higher. This is why a one-size-fits-all approach doesn't work. The titration process allows us to customize the treatment to the person's unique physiology and history of opioid use. We continue this process until the patient reports feeling comfortable and their objective withdrawal signs have resolved. At that point, they have reached a stable dose for day 1. Getting through the first day of induction is a massive achievement, but it's really just the beginning of the journey. The next phase is stabilization. The total dose that was effective on day 1 is typically the dose the patient will take on day 2, usually as a single once-daily dose. The goal over the next several days is to confirm that this dose continues to control withdrawal symptoms and cravings effectively throughout a full 24-hour period. Sometimes, minor adjustments, either up or down, are still needed as the body fully adapts to the medication. This is where consistent follow-up becomes absolutely essential. The patient will need to be in close contact with their healthcare provider, with frequent appointments initially. These check-ins, which might be daily or every few days at first, are crucial for monitoring progress, managing any side effects, and providing ongoing support. We'll discuss how the medication is working, address any cravings, and assess the patient's overall well-being. This is also the time when we integrate other critical components of recovery, such as counseling, therapy, and support groups. Suboxone is a powerful tool, but it's not a cure on its own. It's a medication for opioid use disorder, or MOUD, and the medication part is designed to stabilize the brain's chemistry so the person can fully engage in the psychosocial aspects of recovery. The stabilization phase, which can last for weeks or months, is about building a foundation of new habits, coping mechanisms, and a strong support network. The long-term goal is to move from a life consumed by opioid use to a life of stability, health, and purpose. So that's a detailed look at the Suboxone induction process. As you can see, it's a carefully managed medical procedure with very specific steps designed for your safety and success. From waiting for the right moment to start, to slowly titrating the dose, every step is deliberate. The goal is to get you through withdrawal as comfortably as possible and onto a stable dose of medication that can quiet the noise of addiction, allowing you to focus on rebuilding your life. It's a powerful first step, but it's one that must be taken with the right support. I cannot stress this enough. Please do not try to do this based on a YouTube video. Your journey with opioid use disorder is unique to you, and your treatment plan must be as well. The information we discussed today is meant to arm you with knowledge, to demystify the process, and to help you ask the right questions when you speak with a professional. A qualified healthcare provider can assess your specific situation, your health history, your pattern of use, your personal goals, and create a safe and effective induction plan tailored just for you. If you or someone you know is struggling with opioid use disorder, please reach out for help. There are doctors, clinics, and resources available. Taking that first step to make a call or schedule an appointment is often the hardest part, but it's a sign of incredible strength. Recovery is possible, and you don't have to do it alone. As always, stay safe, stay informed, and be well. I'll see you in the next video.